Hello, and welcome to another podcast from BMA News. I'm Polly Newton, and this week I'm looking at the latest initiative from NICE, the National Institute for Health and Clinical Excellence, to help improve quality throughout the NHS. Everyone who works in healthcare is familiar with NICE's clinical guidelines, its detailed recommendations for the management of specific conditions. Over the last couple of years, though, NICE has also begun to produce documents called Quality Standards. There are 19 of them so far, but from this month, 3 new NICE committees begin the daunting job of producing another 160. Quality standards are shorter and less detailed than clinical guidelines, and much less familiar to many people. So, what are they and why do they matter? The answer to the first is relatively straightforward. Each quality standard contains between 10 and 15 statements which explain what commissioners and providers should aspire to in a particular field of care. For example, the quality standard for dementia says, among other things, that anyone suspected of having the condition should be referred to a specialist memory assessment service. The second question, about the significance of quality standards, is best answered by NICE Deputy Chief Executive Gillian Leng, a former consultant in public health medicine and the woman overseeing the Quality Standards programme.
If we are going to have a really strong commissioning system in future where commissioners drive quality improvements, they need to have a pretty comprehensive set of standards that they can use to inform their contract setting.
The impact of quality standards is likely to be felt throughout the NHS, she says. They will underpin the indicators in the new commissioning outcomes framework and influence decisions about additional local payments to providers under CQUIN, Commissioning for Quality and Innovation. They will inform the best practice tariff and the quality outcomes framework. They're even enshrined in the Health and Social Care Act, which says the Health Secretary must have regard to the quality standards prepared by NICE. But why not simply use existing NICE clinical guidelines?
A clinical guideline is a big piece of work focused on all aspects of care, whereas a quality standard is a much tighter description of what good and high quality care is, that's measurable and that needs to be underpinned by commissioning in the future.
All well and good, but to what extent will clinicians be involved in drawing up these quality standards?
In developing the quality standards, we'll make sure that the new quality standards advisory committees have clinicians from both primary and secondary care as standing members. We will also bring in topic experts as we go through the different types of subject areas who will be co-opted onto that committee, so we actually have expert clinicians involved in the discussion and the decision making.
Representatives from the Royal Colleges will also be invited onto the committees as appropriate. In fact, many of the quality standards are likely to be published jointly by NICE and the Royal Colleges.
I feel quite strongly that it is important that we do this as a joint venture and we get support from the colleges, because although there are a range of mechanisms that we can use to support the use of quality standards through commissioning, it will be important to have clinician buy-in and support from the professions.